Doing an environmental check. I am in my kitchen and that's my equipment I'll be using. And let me just set up my camera. Okay. Okay. I'm entering the room. I'm performing hand hygiene. Hi, my name is Rebecca. I'm going to be your student nurse today. Who do I have the pleasure of seeing tonight?
Blake?
Blake. All right. I am going to close this curtain and give us some privacy. Okay. So I'm here. I'm going to be doing a health assessment. And in this health assessment, I will be doing, it'll take about 10 to 20 minutes. It's going to be head to chest. So I'm just going to be reviewing everything. I might be touching your skin. I'm going to use some of my equipment. Do I have your permission to proceed?
Yep, sounds good.
Okay. Do you want to state your full name?
Blake Bullies.
And I'm going to check. Verify on the armband. Perfect. Can you tell me your age?
23.
What your date of birth?
6/28/97.
Perfect. Thank you. Do you have any allergies?
I do not.
Okay. Then we are going to, on a scale from 0 to 10, will you rate your pain?
0.
Okay. 0 being you have no pain and 10 being the worst pain.
Yep, 0.
Okay. Perfect. So I'm going to start my assessment. And the first thing I notice when I inspect is I notice that his skin tone, it matches the ethnicity. It is appropriate. My patient's posture is erect. He's sitting up. I notice that he has facial hair. He has facial hair. He also has hair on his arms and longer hair. He's dressed appropriate for the occasion. Can you tell me where you are right now?
In an apartment building.
Okay. Do you know why you're here?
Getting a health assessment.
Okay. And do you know roughly what time it is?
About 8 o'clock.
Okay, so I can say that my patient is alert and oriented ×4. And then within talking with my patient, he is also speaking clearly. There is no stumbling. There is no fumbling over words. And I can tell that he is not in acute distress. He's breathing. His heart rate is, his respiratory rate is about 16 beats per minute. There's no sign of any distress while my patient is sitting here, and that he's not grimacing. He's actually kind of smiling, so it's appropriate for the situation. I also noticed that that with his facial expressions and his affect and his mood is also appropriate for the situation. So with that, I also can tell that there are, from inspecting the skin, I can see that there are macules also on the face, as well as some on the neck and the arms. When I feel his skin is warm and dry to the touch, I can see that there is about the same amount of hair on bilaterally on both arms. There's no sign of hair loss. I know, if you will, hold out your hands. Thank you. So I also notice that there is no signs of cyanosis. I notice that he is having good cap refill, less than 3 seconds. I notice that there is no clubbing on the nails. I notice that there are no wounds, lesions, no open wounds on either arm. I'm not noticing any open wounds or lesions. And I'm noticing that the skin is warm and dry. Moving on, I'm going to just kind of touch your hair, okay? Upon palpation, I'm not noticing any lesions or wounds, no infestations of the scalp. You could just tilt your head down. Thank you. Just some hair dandruff you can look up, which is about normal for the season that we are entering. I'm noticing that the skin tone matches the ethnicity of my patient. I notice that the facial features are symmetrical, so eyebrows are both symmetrical, the eyes are symmetrical. The nose is also symmetrical to the midline. So is the mouth. Both features are symmetrical. The hair that is growing is also symmetrical on the face. There's no piercings, no tattoos, no open wounds or lesions. I'm just going to palpate. So I'm just going to feel your face, Blake. Perfect. Thank you. So I'm noticing that there's no redness, no tenderness. Did any of that hurt? Right, so there's no tenderness, no redness. I'm noticing then that the eyes, when I look at them, the conjunctiva is moist and pink. The sclera is white. There's no drainage, no hair loss from the eyelashes, so no wounds around the eye. I'm noticing, so what I'm gonna do, if you'll look forward, okay? Just look forward. Okay, do that again, perfect. So I'm noticing that the pupils are equal, round, reactive to the light, and accommodating. So there is perla there. So there is light accommodation. Then I'm also noticing that his eyes are blue, and that there are no wounds around the outside of the eyes. Will you close your eyes? Perfect. So there's also no redness above or around, no tenderness. All right, you can open your eyes. Perfect. Okay. Then next I'm noticing that when I palpitate the ears, does any of this hurt? Okay. So doing the post-auricular and pre-auricular, does any of this hurt?
Nope.
Okay. The tragus, so I'm noticing that everything, I'm just gonna look in your ear. So upon palpitation, I'm gonna do this in both ears, okay? Perfect. So there is a little cerumen, so he does have some earwax buildup, but there is no pain upon palpitating the skin. So the skin has I'm not seeing any skin deterioration or breakdown. There's no lesions, no wounds on the ears. I'm not noticing any discharge from the ears. And the only thing that I'm noticing is that there is some earwax. And that there was no pain upon palpitating the ears. I noticed, so I am going to do just one test, okay? So if you will, cover your left ear. Perfect. Just repeat the words that I say, okay?
Brown shirt.
All right, and if you'll cover your other ear.
Blue jeans.
All right, so I'm not showing there's no signs of hearing loss. So I did a whisper test and both words were correct. So then next, I am just going to inspect. Then I noticed that there is, that the nose is symmetrical to the midline. So I'm going, upon inspection, I don't see any lesions or wounds. I notice that the skin tone matches the ethnicity. I'm just going to look into your nose. Nasal septum is also symmetrical. There's no drainage. Beautiful. There's no deformities to the nose. There's no drainage coming from the nose. The nasal septum is intact and is symmetrical. The nose on both sides also symmetrical to the midline, and is appropriate size for my patient's body. When upon looking in, I notice that there's no hair loss either. If you will, Blake, place one finger on your left side of your nose and breathe in and out. And the other side. Perfect. So my patient is able to breathe in without any having to force air in and out. He's using his nose appropriately upon closing one side. So that tells me that my patient, can breathe in and out on both sides of the nose. Next, I'm going to inspect the mouth, and I see no signs of cyanosis, which I would notice blue around the lips. There's no signs of cyanosis. I notice that his lips are a little dry, but they're not cracked. They are pink, and they are also appropriate tone for the skin. If you will, Blake, go ahead and open your mouth. I'm just going to shine a light and take a look. Beautiful. Buccal mucosa is appropriate. The tonsils are not enlarged. Appropriate number of teeth for my patient. They're, you can go ahead and close your mouth. Perfect. Not missing any teeth. Oops, sorry. Not missing any teeth. I noticed that his mucous membranes are intact. I noticed that it is moist and pink inside. There's no lesions or wounds on the inside of his mouth. I noticed there's also no lesions or wounds on the outside of his mouth, and he was able to open and close his mouth without. Did it hurt when you opened or closed your mouth?
Nope.
So he's using his mouth is fine. It is, everything looks good with that. So moving on, then first what I'm going to do is I'm just watching for Blake as he breathes, counting respiratory, watching my clock. Perfect. So there's about 17 beats per minute.
What do you want to play?
For a respiratory rate. And next thing that I'm going to do is I'm going to palpitate.
What do you want to play?
If you will, you can just kind of raise your arms. There you go. Is any of this tender or hurt?
Nope.
I see no signs of scoliosis. I'm going to, no signs of kyphosis. Upon placing my hands, Blake, can you take a deep breath in and out? No signs of barrel chest. So I'm just going to listen. So if you will, yep, keep your arms kind of out for me. Perfect. I'm listening. Left upper lobe. Right upper lobe. Left middle. right middle, left lower, right lower, perfect. So I'm going to the back. If you could turn your body just so that my professor can kind of see where I'm going. So right upper, left upper, deep breath in and out. Perfect. Right upper, left upper, right lower, and I'm moving in a Z pattern. Left lower. So I'm seeing no signs of accessory muscle use. The sounds are vestibular, so his breathing sounds very good, and his beats per minute, respiratory beats per minute, is within a normal range. You can turn facing forward. Thank you. So next, I'm just going to first inspect, and I see I'm going to feel for a carotid pulse. Feeling for a carotid pulse. Feeling for a radial pulse. Radial, so the pulse is strong, 2+. Bilaterally. I see no JVD, so no jugular vein distension noted. So I'm going to palpitate. Does any of that hurt? Okay. Then I'm going to auscultate. Going to the right. If you'll just breathe normal. Listen to the intercostal space. For a pulmonic. Then going to the second intercostal space for aortic. Alright. I'm listening to Herb's point. Sorry, that was actually really cool. To tricuspid. And the mitral. Now I'm going back and I'm going to do the same with my bell, pulmonic. So I'm listening, I'm not notating any murmurs, so I'm listening for murmurs and I'm not finding that there is any murmurs. So same, the aortic, to Herb's point. Sure, tricuspid. Mitral. And then the conclusion of my findings are that I did not hear any heart murmurs. Blake has a very strong beating heart. That the S1 is greater than S2 at Herb's Point, and yeah, it was really cool to listen to that. Blake, I thank you for coming in. I am going to put the bed in the lowest position. It was in the lowest position so putting the bed in the lowest position, the rails are up, and the rails, so the bed is in the lowest position, the rails are up and locked. Blake, I'm just going to ask, are you on a scale to 0 to 10, where is your pain? Where do you rate it? 0 being none, 10 being the greatest?
0.
0. Okay, and I'm going to give you this collet. And if you have any needs or if you have any needs or there's an emergency, you just press that collet, and that will let us know that you're calling out. Do you need anything at this time? Maybe a glass of water? Can I get you a warm blanket?
No, no.
All right, well, I did. It was my pleasure doing your health assessment. Everything looked great. You are very healthy for your age, and your heart is very strong. I can hear that heartbeat really strong. So I had my pleasure taking care of you tonight.
Thank you.
Okay. And I'm leaving the room so that my camera can see. And I'm doing hand hygiene. All right, you have a great night.
Okay.
And then I actually have to get the camera.